And in this video, as the trial of the nurse Lucy Letby nears its conclusion, the jury now hear from the judge and his final summing up of the case against Lucy Letby. The judge turns to the case of child B and relays the care and events leading up to and the time of her collapse. A nurse colleague said she had her gloves on and was drawing up medication when child B collapsed at 12:30 a.m. Letby had said child B was not breathing. The nurse said child B looked like child A, with blotchy discoloration. A cyanosed appearance was recorded in the notes. The notes added the colour changed rapidly to purple blotches with white patches. Letby said she'd accepted being in room 1 at the time of the collapse. She said the colleague had alerted her to child B's collapse. Dr. Rachel Lambie said the most unusual observation for child B was a, quote, dusky pale grey colour, then developing widespread blotches of a purple-red colour which would flush up, then disappear, then appear elsewhere. They were flitting all over. It took about 90 minutes for the grey colour to disappear and be replaced by pink, she said. She said this was a very unusual event which she has not seen before or since, and child B recovered quickly. Blood gas results came back as normal. Letby said she had been asked to get a camera to get a photo of child B, but when she had returned, the discoloration had gone. A female doctor recalled purple blotching to the mid-right abdomen and right hand, which she was puzzled by. The rash was so florid and so very unusual, she said, and its quick disappearance was not normal. Dr. Evans said child B was stable prior to the collapse. The collapse was either the result of smothering or air embolus. He said if the cause was hypoxia or infection, the effects would stay. He said the fact child B survived meant it was likely less air was administered or it was administered more slowly. Dr. Bowen said child B was compromised at birth but responded very well to resuscitation and breathing support measures. The circumstances of the collapse were very disturbing and there were no other warning signs. The dislodging of the nasal prongs for child B had been resolved. She based her air embolus conclusion on florid skin colour changes and ruling out other causes. The defence say it cannot be excluded that child B's collapse was a natural event. The judge refers to the case of child C. He says medical experts found it difficult to conclude the cause of death, but Dr. Manarides said it was air administered into his stomach via the nasogastric tube. Letby said she did nothing harmful to child C, and a cause such as a gastrointestinal blockage cannot be excluded, that child C should have been treated at a tertiary unit, and there was a failure to react to bile aspirates, vomiting, and an overall lack of care. Child C was born in good condition and was on the margins of being treated at the Level 2 Countess of Chester Hospital neonatal unit, the jury is told. The judge recalls the events leading up to child C's death on the morning of June 14th. Nothing stood out as worrying for child C from observations, but there was caution for his care. Professor Arthurs said radiographs for June 12th showed left-sided chest infection and marked dilation of the bowel. Symptoms of this included CPAP belly, NEC, sepsis or air embolus. Bile was later noted on child C's blanket on June 13th and 2 ml of black stained fluid was obtained on aspirates. No desaturations were observed. Bile aspirates was a concern in neonates but not that unusual and not a major cause of concern, the court had heard. Dr. Gibbs said the bile for child C was a worry, but the aspirates were not increasing and his overall observations were satisfactory. An obstruction would have been found post-mortem. Dr. Sally Ogden said the observations were a concern and the x-ray showed a loopy bowel. Child C was still pink and well perfused and he had no concerns with breathing and the abdomen was soft to touch, which was reassuring. Dr. Gibbs had no particular concerns about child C that day on June 13th. Babies with NEC develop a hardened abdomen, the jury was told. Messages showed Letby wanted to, quote, throw myself back in to the neonatal unit. She said that meant getting back into looking after babies, as that was what she was taught at Liverpool Women's Hospital. The messages included Letby saying, quote, "From a confidence point of view, I need to take an ITU baby soon." Sophie Ellis, a Band 5 nurse, not intensive care unit trained, was supported by a Band 6 nurse that night shift to be the designated nurse for Child C in Room 1. At the start of the night shift, there was a hope to start Child C on feeds. He was pink, well perfused, active and alert. At 10:34 p.m, Letby said she had done a couple of meds in Room 1. She believed Sophie Ellis didn't have the skill in caring for premature babies. Sophie Ellis was alerted to Child C's desaturation. She said she had been alerted to the desaturation by Letby, who had said, quote, "He's just dropped his heart rate and saturations." This was something she had not put in the nursing notes, but something she said to police. She said she did not do so at the time, as it was ultimately a traumatic event. She said she did not do anything to Child C and didn't see anything being done to him. Letby was, quote, "stood at the incubator at the far side." A nursing colleague said she believed she saw Melanie Taylor and Sophie Ellis by Child C. Child C was not breathing, very blotchy, and was not aware if Letby was in the room. Melanie Taylor said in evidence when she approached the incubator, Letby was already there. She said in police interview she was in Room 1 feeding another baby and was called over by Sophie Ellis, not mentioning Letby. Letby said she had very little independent memory of events. She said she had given evidence on Child C's collapse, having been placed there in the room by Sophie Ellis's account. Dr. Gibbs said efforts to intubate were unsuccessful due to swollen vocal cords. Sophie Ellis said she got upset at the situation after Child C's mother arrived, as it was overwhelming and she had not been in that kind of situation before. Lucy Letby said to her, "Do you want me to take over?" Sophie Ellis said yes and left Room 1. Dr. Catherine Davies said even the smallest, sickest babies would respond to resuscitation, but Child C did not. Dr. Gibbs said he could not find anything that would allow the heart to restart long after resuscitation had stopped and could not understand that from a natural disease process. The mother said in an agreed statement she recalled CPR being performed on Child C. The heart rate had fallen unexpectedly and rapidly. She says she did not grasp the gravity of the situation and was shocked when asked by a nurse if she wanted a priest. She asked if Child C was going to die. The nurse, described to be in her mid-20s, replied, "Yes, I think so." The father of Child C said a nurse, who he later believed to be Letby, had said to the parents in the family room, "You said your goodbyes now, do you want to put him in here?" referring to a basket for Child C. He said Child C's mother said, "He's not dead yet," and the nurse then backtracked. Letby had accepted she had made searches for Child C's parents on Facebook 10 hours after, but could not remember doing so or why. She questioned whether she was the nurse who said the "you said your goodbyes" comment and did not recall saying it. She said she was very sad for the parents. In evidence, she said she did not recall any specific contact with the parents. She said the search for the parents were, as they were, quote, "very much on her mind at that time, as you don't forget events like those which happened to Child C." The nursing colleague recalled asking Letby more than once to look after her designated babies that night, and it was not part of her responsibilities to be in the family room. That was for Melanie Taylor. Dr. Kokai carried out a post-mortem examination for Child C. He noted a distended colon, which Dr. Marnaridis said was not an abnormality. He said the potential complication was a twisted colon that would lead to obvious symptoms of pain. There was evidence of acute pneumonia. Dr. Marnaridis said one could die of pneumonia or with pneumonia. He said the former was plausible, but upon hearing further clinical evidence, he reviewed his opinion. He said babies dying of pneumonia experience gradual deterioration, which was not seen in this case. He said he revisited the cause of death, viewing images of the distended stomach and no evidence of NEC. Professor Arthurs said the small bowel was dilated. Dr. Marnaridis observed a dilated stomach and bowel and noted Child C had been off CPAP for over 12 hours. No air had been obtained from aspirates before the collapse. He had never known CPAP belly being the cause of an arrest in a baby in his years of experience. He said in his opinion the cause of child C's collapse was of excessive air administered into the stomach via the nasogastric tube. The judge says Dr. Evans said the pneumonia infection did not cause child C's collapse. The cause was difficult to explain. Initially, he said it was, quote, unexplained. He said excessive air in the stomach can cause splinting of the diaphragm. The judge said he did not give that conclusion before giving evidence, and it was not advanced in his 8 reports. Dr. Evans denied he was coming up with things now to support an allegation of harm. Dr. Evans said from an academic point of view, air embolus could not be excluded. The judge says Mr. Myers was critical of this late conclusion. Dr. Bowen had said her conclusion of the, quote, bubble in the stomach was if the NGT was not on free drainage, then it could have been accumulation of gas by CPAP. The alternative was the deliberate administration of air via the NGT. She said child C died with pneumonia, but not because of pneumonia, and that would have made child C less responsive to resuscitation. In reaction to questions about bowel obstructions, she said child C would have had a distended abdomen and normal bowel sounds would not have been heard. The judge said Dr. Bowen had added there were no clinical indicators of obstruction. The trial judge now turns to the case of child D. He recalls the baby girl's birth and that she died 36 hours later on June 22, 2015. The prosecution's case is air was administered intravenously. He says the guideline was for child D to be given antibiotics at birth due to the gestational age, and this had not been done. The prosecution said while child D died with pneumonia, not of pneumonia, the defence say you cannot be sure of that, and the cause could have been infection. Dr. Sandy Bowen said child D should have been screened at birth due to her low temperature, which was a sign of infection. Child D was placed on CPAP breathing support. Her heart sounds and capillary refill were normal, abdomen was soft and non-distended, and the chest was clear. The parents were informed it was likely sepsis. Child D stabilised on CPAP. Child D was intubated and ventilated after showing signs of acidosis. An X-ray showed very little abnormal according to Professor Owen Arthurs. Child D was given the protein surfactant. Child D was weaned off the ventilator and extubated. Dr. Elizabeth Newby said child D was a little stiff and hard to handle and felt there was an element of infection. Dr. Bowen said child D had signs of pneumonia but was recovering. Child D's mother recalled an event when she arrived on the unit and Letby was, quote, hovering round child D, not doing much, holding a clipboard. She asked if everything was okay. Letby replied everything was fine. The mother added she just stuck around. The mother said Letby was told to go away, or words to that effect. Child D's father did not recall this event. He recalled he was given a Father's Day card on June 21st by the staff. He said nurses were friendly and warm and was made to feel welcome when he went to the unit. Professor Arthurs said a radiograph of child D from the afternoon of June 21st showed the catheter was in the wrong position. There was a sign of infection, but nowhere near as prevalent as that seen for child C. Child D showed big improvements and good progress on June 21st. This was in relation to blood tests and respiratory efforts, although she was not stable enough to have a lumbar puncture. She was responding well and her tone was reasonable. Child D desaturated to the 80s when attempts were made to take her off CPAP. Dr. Sarah Rylance was happy with child D's clinical condition by this stage, quote, stable and making good progress. The judge says shift leader and designated nurse for child D in room 1 on June 21st to 22nd was Caroline Oakley. Letby was designated nurse for 2 other babies in room 1. Child D was on nasal CPAP in air with satisfactory gases. The readings for 7:30 p.m. to 12:30 a.m. were all normal, and she was happy with child D. Aspirates found had minimal importance, as child D was not being fed at this time. Caroline Oakley said she assumed she began an infusion at 1:25 a.m. being the designated nurse, but the writing on the infusion note was not hers. One of the nurses on duty was aware Caroline Oakley had been on her break and checked child D, who was fine. While she was at her computer, she was alerted to alarms and found the monitor was showing child D was desaturating at 1:30 a.m. She recalled Letby was there. She noted child D had a rash on her trunk and arms, and it was, quote, not like a normal rash, this was like a mosaic, like vessels of blood meeting with each other. She said she had not seen anything like it before. She said her trunk and legs went a mottling colour and it was very odd. She discussed it with Dr. Andrew Brunton. Child D then settled and discoloration seemed to disappear and dissipate. Caroline Oakley said the rash was, quote, different to mottling and it was very unusual. She, quote, had an episode but responded very quickly. Another senior nurse said she had a limited memory of events. She remembered child D being stiff and having a rash on her trunk, which was an odd, unusual rash. The judge says at 3 a.m. there was a second event. Caroline Oakley said child D was crying and desaturating, and the skin was discoloured but less than before. Dr. Brunton recalled child D was agitated and upset and thought it was something to do with the face mask. He saw skin discoloration, but this was not as obvious as before. A prescribed saline bolus was signed for child D at 3:20 a.m. by Caroline Oakley and Lucy Letby. Nurse Oakley said they were happy with child D and she would be provided with expressed breast milk. She said if child D was unstable, she would not have changed child D's nappy. Observations were, quote, fine by 3:30 a.m. At 3:45 a.m, child D's monitor was alarming. Caroline Oakley found child D had stopped breathing and was apneic. Dr. Emily Thomas heard the call for help. She asked a nurse to put out a crash call for Dr. Brunton. He ran when he was crash called. Full resuscitation was carried out on child D with the assistance of doctors and nurses, including Lucy Letby. There were, quote, secretions +++ from the nose and mouth. The parents were informed and went to the unit. After 28 minutes of resuscitation attempts, it was decided to stop. At 4:50 a.m, Dr. Newby had a discussion with child D's parents on the sudden collapse. She agreed babies can suddenly collapse, but was surprised child D did. She, quote, did not appear to be a baby in extremis. A nurse had a conversation with Lucy Letby about the drugs administered during resuscitation. Letby asked the nurse how she knew the doses to give. The nurse replied she knew them from her years of experience and recommended Letby learn them as well. Dr. Marnarides said pneumonia was likely to be present at birth for child D. Professor Arthurs talked of a black line in front of the spine, indicating gas in the great vessels, which was unusual in children who had died without an explanation. It was present in 2 other children, one of whom was child A. There was, quote, more air in child D than child A. One explanation was someone was injecting air into the child, and the radiograph images were consistent with, but not diagnostic of, externally administered air to child D. Dr. Marnarides said the presence of air in such a vessel was significant. He said, from a pathology point of view, air embolus could not be proved. He said there was no other natural disease that could explain child D's death. He said, in his opinion, child D died with, not from, pneumonia. He concluded the likely explanation was air embolus. Dr. Evans said the 1:30 a.m. episode was very surprising and unusual, as child D had been responding to treatment and was a stable baby. He said child D had symptoms of early onset pneumonia and had developed that before birth, but was making a recovery. He said he could not think of any events which would end with unsuccessful resuscitation, and the cause was an air embolus. Dr. Bowen peer-reviewed Dr. Evans' reports and conclusions. She said the striking feature of all events was they were very sudden and unexpected, and they came with mottling of the skin. She said it was a concern that child D was crying in the second event. She said although antibiotics were given late, there was nothing clinically to suggest child D was going to collapse. Quote, "This was not a picture of a baby with pneumonia severe enough to collapse." She was clear infection did not cause the sudden collapse. There were episodes of discoloration, which was consistent with the limited recorded events of air embolus. She concluded air had been administered intravenously, causing an air embolus. The judge says Lisa Walker, a Band 4 nurse, talked about an event of being in room 3, where Letby was feeding babies via a nasogastric tube. The alarm on the portable monitor went off, and Lisa Walker went over to help. Letby stopped the feed and began stimulation for the baby, but was not getting a response. She saw colleague Kate Bissell walking past and shouted for help as the baby was not picking up. A doctor working on a computer went over to help. The baby was given gentle stimulation and picked up. Lisa Walker said Letby asked her quite firmly why she asked for help. She said Letby was quite cross and the Band 4 nurse didn't respond. She said Letby's demeanour was that she would have been fine and didn't need any help. Letby in police interview denied doing anything deliberately harmful to child D. She said she could not remember doing Facebook searches for the parents of child D 3 days after child D's death. She said she could not recall why she said child D looked like having overwhelming sepsis or that there was an element of fate in babies. In evidence, Letby said she didn't really remember the night shift. She said she would have been caring for her designated babies and assisting colleagues with theirs. She did not remember being called into room 1 at 1:25 a.m, child D desaturating at 3 a.m, or child D collapsing at 3:45 a.m.